Hi, I'm AJ Loiacono, the CEO of Capital Rx, and I'm joined today with Holly Maloney, a partner with General Catalyst.
Hey, hi everyone. Good to be here with you.
Well, it's great to be here. We've had a very interesting 2022 with a combination of interest rate changes, geopolitical affairs, as well as just changes in general to the investment sector. So kind of what are some of the things that you've seen with 2022?
Yeah, I mean, 2022 has certainly been an interesting year for all of the reasons that you mentioned. But the reality is that as we think about our investing at General Catalyst in healthcare, healthcare is secular, not cyclical. So regardless what's happening with inflation and, geopolitical challenges, people are still sick. And our healthcare system is still broken, which is why we have a really clearly defined thesis around health assurance, which is making our system more personalized, proactive, at a lower cost, and more accessible for the most marginalized communities. And all of those statements are still a work in process, but it's why we have a dedicated team. We have a dedicated fund that invests in companies of all stages that are really addressing this thesis area, and we're still really actively investing. So even though if you look at the stats that Rock Health will release, that the third quarter of this year was, I think, the lowest funding quarter in 11 quarters that they've seen. We've still been really active. I recently made investments in companies like Maven Clinic in the women's health space, Ripple in the senior behavioral health space, Cartwheel in the K-12 behavioral health space. So we're still really actively looking for exceptional teams that are building enduring companies, because enduring companies should endure, and that means lasting through many different market cycles. And it's certainly why we invested in Capital Rx in 2022. I think it was May or June.
Yes.
When the investment closed, is because Capital Rx is so aligned with our health assurance thesis. We've been studying the PBM market for a really long time and have never found the model and the team that felt compelling to invest in. And, understanding the nuances and all of the challenges with that space from a transparency perspective, from a technology perspective, there really is no modern infrastructure to support, a fully transparent, lower drug pricing that we all need and should expect as consumers. So once we met you and your team, we just knew that this was absolutely the opportunity that we wanted to meaningfully invest in, again, regardless of the backdrop of the market.
Yeah, and obviously we're incredibly appreciative, because without strong partners, companies like ourselves can't tackle some of the biggest problems in healthcare.
Yeah. Well, speaking of 2022, I mean, what did you as the co-founder and CEO of a really fast-growing company in the healthcare space see as your biggest challenge over the last year?
Yeah, I think for us, let's start with the growth factor. Whenever you grow over 100% year over year, you obviously have a host of challenges in general with staffing, operational support. Your go-to-market strategy is refined as well, but I think it's also kind of leftovers from the pandemic, where we were originally 100% or close to 100% New York City-based organization, and we came in 5 days a week. It didn't matter if you were an engineer, salesperson, pharmacist. And then, we look at the accelerated growth, and suddenly we're in 31 states.
Wow.
And we're only about 35% New York metro region. And so we grew rapidly but apart, but how do you stay unified? So I always say that's one of the biggest challenges, because throughout my career, I always feel like staying in touch with all of your colleagues is so important, because you're constantly looking for who are your next gen leaders, who are your A players that are going to stand up and take on new challenges. And oftentimes these become your peers, over time in the organization, which is absolutely true historically for this organization and for other firms I've worked with. And so I think the greatest challenge for us, I just go back to, is hyper growth and kind of this disparate office environment that's also hybrid. So even when you can come into the office, you don't have to.
Yeah.
And I think that's an important part, because I will say, even myself with work-life balance, I, on some level, was reintroduced to my family. And I think it's amazing that you have that opportunity and you do gain efficiency, but there is something missing. And I think that's something that we worked very hard through communication and training, and we're still solving for as we move forward. And it's something we'll probably still have to address in 23 and beyond.
Yeah.
So what are your biggest challenges that you faced in 2022?
Yeah, it's a really good question. Despite the tornado that is having 2 babies under 2, which is, a whole different set of challenges. But as I think about the business that we're in, one of my partners always says is that you need to define reality but give hope. And so really using that in the context of the environment that we're in, where you do really need to define reality for the companies that you're invested in, partnered with, in the trenches with, in terms of the economic backdrop of, a shift from the focus on growth at all costs to, what is the stability and, overall operating leverage of a business. We've definitely had to, kind of shift and sometimes educate for, younger first-time founders what that really means and how to set up the company, not just for the immediate term, but for long-term success. Because, as I mentioned, we look for companies that will endure, and the only way you'll endure is if you kind of survive this time and can, prosper under a slightly perhaps different financial model. But then also give hope, right? Because there is still no better time to be building a company than today, especially in healthcare, given the enormity of challenges that we're trying to solve. And so still making sure we're inspiring people to innovate, even if it might be, again, under a different set of circumstances, but to still be willing to take risk and, be willing to push the boundaries of the art of what is possible. It can be a tricky, dance to navigate, but it has to be the focus for us as a partnership. And we have that fiduciary responsibility to our LPs, which includes some of the health systems and endowments and pension funds, to ensure that the companies we're investing in can thrive.